Good morning. Thank you, KSOs, for including me in this program. My presentation is about ocular alignment tests, which are a group of basic tests to be done in all patients after visual acuity is assessed. Ocular alignment literally means that eyes are in the correct relative position. We say ocular alignment is present when visual axis of both eyes are aligned. And then what is this visual axis? It is a line connecting the fovea to the fixation point. And when a person looks at an object, the visual axis of both eyes usually meet at the point of fixation. And that is not happening in this patient as the visual axis is misaligned. So this misalignment of visual axis is also called squint or strabismus. This patient has a ESO deviation or a convergent squint. So why is it necessary to look for the alignment test? It's very important in children. You can see the child with a significant ESO deviation getting corrected with appropriate refractive correction. In adults also, so neurological diseases like third nerve paralysis, myasthenia, thyroid eye disease, and trauma like blowout fracture is associated with ocular misalignment. There are 4 groups of tests for ocular alignment. They are the corneal light reflex test, cover test, dissimilar image test, and dissimilar target test. Of this, the first 2 are of importance, and that will be dealt in detail. Coming to corneal light reflex test, HIRSCHBERG test, Bruckner test, modified KRIMSKY's test, and tests based on synaptophores can be used. And of this, HIRSCHBERG test is the commonly used test for acute assessment of alignment, and it is useful in all who cannot cooperate for cover tests and also having poor central fixation. So here, patient is asked to look straight ahead. Light is thrown into the center of the forehead at the distance of about 50 centimeter. Now, the light reflects in both eyes. The reflection of light in these both eyes are compared. Usually, they are usually central and symmetrical. But suppose it is displaced temporally, it means that eye is deviated in, or there is a convergent deviation. If it is displaced that's nasally, it means that there is a exodeviation. And similarly, it can be displaced superiorly or inferiorly in vertical deviations. This test can also be used to quantify the amount of deviation based on the assumption that 1 millimeter of decentration is equal to 7 degrees of deviation. So this is 15 degree isotropia, this is 45 degree isotropia, and so on. But though it's a very simple test, there are certain disadvantages. It's basically a subjective test, and it's also of no use in certain patients with pseudostrabismus, where there is an influence of angle kappa. So then what is this angle kappa? It is the angle between the visual axis and the pupillary axis. And usually, as the fovea is slightly temporally displaced, you get a nasal reflex. So usually you have about 4 degrees of angle kappa. But sometimes this reflex can be displaced nasally or temporally. When it is displaced nasally, it is called a positive angle kappa, as seen in this patient with who had retinopathy of prematurity and dragged macula, having a very nasally displaced reflex. This simulates exodeviation. Similarly, if it is displaced temporally, as in case of high myopia, it will simulate an ESO-deviation. So in such cases, HIRSCHBERG test is of not much use. The another light reflex test is of importance is BRUCKNER'S reflex. That is especially very useful in young children, and it is performed by visualizing the red reflex in both eyes simultaneously after dilatation. And you can easily see that in the deviated eye, the light reflex is brighter and lighter. The KRIMSKY's test and tests based on synaptophore are basically used to more to measure the angle of deviation, and will be discussed in the orthoptic class in the next session, next Sunday. So moving on to the cover test. These are the most objective and accurate tests to demonstrate ocular misalignment. There are three types. They are the cover test, cover and cover test, and alternate cover test. There are certain prerequisites like central fixation. Patient should have good vision and reasonable range of ocular motility. So these are the things to be done before starting the test. And most important is proper covering of the eye and making sure that the other eye is looking always at the fixation target. These are the pictures of equipment, occluders, and other
Dr. Sujatha, you're muted.
She's not audible. She's not muted. She's not audible. Madam, can you check your connection?
moving out to take up fixation, indicating that it was previously in a convergent position. So, you know, there is a esotropia. Second part is that you remove the cover, still looking at the left eye. There are two possibilities. One is that eye will fixate centrally or suddenly go back into the deviated position. This child has exotropia. And when you cover right eye, you can see the eye going in to take up fixation. You are removing the cover, still the right eye is remaining central in fixation. So the test is repeated in left eye also, and the patient is having alternate divergent squint. Then cover uncover test is usually used to detect any latent deviation. Here your eyes is prevented by the property called fusion, and you are now covering the left eye. So fusion is broken, and suddenly you remove the cover, noting the position in the left eye itself. You will see that the eye has moved out to take up fixation, and indicating previously it was in a deviated position. And you will say that patient is having esophoria or latent deviation. And speed of recovery movement is very important. You can see in this patient, to start with, he's having straight eyes. But when you disrupt the fusion by covering, you can see exophoria being manifested. Note the manifest exophoria and speedy recovery movement in both eyes. Moving on to alternate cover test, it detects the maximum amount of misalignment, that is latent as well as the manifest component. Here you are switching the cover simultaneously, repeatedly between two eyes, and you are watching the movement. The aim is to maximally dissociate the eyes. So after this test, the patient will be either the aphoria may break into atropia, that is latent may manifest as manifest squint, or a manifest squint may increase in its amplitude. These are the test results we obtain after the cover test. Then other signs like latent nystagmus and incomitance also may be picked up. Moving on to dissimilar image test. It was mentioned before about the MADDOX rod. MADDOX rod test and double MADDOX rod test are commonly used. It was previously told by Simon sir about MADDOX rod. You get MADDOX rod converts a point source of light into a line image. You can see it here. So patient fixates the light at 6 meters, MADDOX rod in front of one eye. And this is what you get if there is no misalignment. And misalignment can be demonstrated easily like this in these two cases. And it is all used to measure phorias for distance. Double MADDOX rod is similar to MADDOX rod test, but here you have two MADDOX rod. One is red and one is white. And if it is normal, you get the result as two lines will be parallel. If there is cyclodeviation, one red line will be inclined. MADDOX wing test is actually not a dissimilar image test, it's a dissimilar target test. This is the instrument. When you look through the patient, this is done at 33 centimeter. Patient looks through the right eye, sees a vertical and horizontal row of numbers indicating the amount of deviation, and left eye sees one vertical white arrow and a horizontal red arrow. This is basically used to measure deviation, that is heterophoria, that is latent deviation for near. Due to the shortage of time, I'm not going into dissimilar target tests. They are very rarely done, and only for to assess complex case of strabismus. At this point, I would like to conclude by saying ocular misalignment in children, it should be detected very early. HIRSCHBERG test may be used as a preliminary assessment of deviation, but if you want to report the presence or absence of a strabismus when you are asked for it, the objective method like cover tests are mandatory. Thank you.